You're looking at Lachor Hospital in the Gulu district of northern Uganda. What started as a 30-bed health clinic has since grown to over 500 beds, the second largest health facility in Uganda, with surgical centers, radiology labs, outpatient clinics, and a host of medical services. Now imagine if this vital, life-giving hospital never existed. What would have happened? Well, over 200,000 patients a year would have had no place to receive quality medical care for as little as $1 a day. Pregnant women, children under the age of 6, and patients without financial means to pay even that small amount would receive no care at all. And with no care, diseases like malaria, pneumonia, even relatively minor injuries could prove to be death sentences. Without Lachor Hospital, thousands of community members would not have been able to seek refuge in the 1980s and subsequent 2 decades when the district of Gulu was terrorized by Joseph Kony's LRA rebels. And without the astonishing efficiency, dedication, and skill of the staff at Lachor Hospital, hundreds more would have died during the Ebola outbreak that ravaged northern Uganda between October 2000 and February 2001. In 2000, Sharon McGee-Crary traveled to Uganda as part of the International Ebola Response Team and imagined all of that. She saw that the best way to care for the people of Uganda was to support the hospital that already cared for them. So enlisting the education and fundraising expertise of her sister-in-law, Sarah McGee, the two co-founded Social Promise. Donors to Social Promise help sustain Lachor Hospital without interfering in the way care is already given or adding any additional burdens or dependencies. The doctors and nurses of Lachor already know how to treat patients, deliver babies, and perform intricate operations. They just need the financial support to continue their life-saving work. A member of the Social Promise team travels on a regular basis to monitor the resources Social Promise allocates not only to Lachor Hospital, but to St. Jude Children's Home, which hosts care for orphans, a primary school, and a home for children with special needs. Educational programs, including the signature African Adventure event, allow Sarah to provide American children with an avenue to think creatively about both current problems and changing the future for children and families living in Gulu, Uganda. Every dollar Social Promise raises is accounted for, and every donation goes to help alleviate sickness, reduce poverty, and get people back on the road to stability. So what if the volunteers at Social Promise never dedicated themselves to the people of Uganda? When you try to imagine that possibility, it's hard to imagine money better spent. To learn more about Social Promise and how you can help the people of northern Uganda, visit socialpromise.org.